Well, I'm sure people are getting really excited about silver. That there's so many fantastic ways to use it, and I'd love to get into that and take a dive into different applications.
I'm happy to help.
I'll just say this off the top. I mean, we use it in all of any pathogen protocol. We always lead with the Argent and silver.
Well
so, I mean, and we're talking orally, but I know right now we've got the oral thing. We're going a little bit different than that.
So let's say you got your diet in place, you're exercising, you're meditating,
mucus.
You're doing
How do you protect
perfect.
your mucus membrane?
Spraying it up the nose.
Yeah.
I've got
we have one. Yeah. So we have this is membranes out here.
Right.
That's mucus membrane.
Vertical spray.
Yeah. Vertical.
We don't
spray.
call it a nasal.
And you can use that in the eyes, of course. What do you call it?
Vertical spray.
Yeah.
It's
okay, man.
Honestly,
it's okay.
You make me emotional.
One of the studies that I read recently was how silver interacts with biofilm production, and it inactivates the biofilm. And,
correct.
One of the things that we do a lot in our office, and I know that you're a big proponent to this, especially with people that have chronic mold illness and Lyme disease, is they get these really nasty populations of bacterial infections that are resistant, Marcons,
because of the biofilms.
And so then the biofilm acts like a flypaper. So anything they're breathing, like if there's an airborne virus, it's got a place to stick
and land and stay.
Food,
exactly. It's like an aircraft. It's like a jet landing on an aircraft carrier. It's got the hook, and it's on the ground on that surface.
So one of my goals with patients when we start working with them, especially if there's a viral concern, is basically cleaning up that nasal pharynx.
Of course, I think that's brilliant. Absolutely right. And just so you guys know, I'm sure you know this, more than 90% of the pathogens on the planet anyway have a biofilm component. More than 90%. So biofilms are everywhere. What are you using to get through them? The silver will get through a biofilm. Again, subject to particle size. Particle size, particle dispersion, particle charge, which is the nexus again. What makes this stuff so special? Why do we look so homogeneous under the microscope? Because we're more than 98% actively charged. So you've got the smallest particles in the most uniform dispersion, almost all with a positive charge. They're going to seek and destroy. For me, the nebulizing aspect is phenomenal. When you think of, again, the properties of silver, antiviral, antifungal, antimicrobial, antibacterial, anti-inflammatory, inflammation is almost always part and parcel of infection.
Well, let's back up a second, because people are watching and they don't know what a nebulizer is.
I was just going to say that.
So
you can pick one up for $50.
So a nebulizer is a machine where you can put a liquid in it, and it actually puts the liquid into a tiny mist, a fine mist.
Fine breathable mist.
And when you breathe it in, it actually can get not just the nasal pharynx, but the sinuses, and even all the way down into the lungs and the esophagus. Yes. So the obvious uses for silver nebulizer, right, is an infection. I mean, whether you have an acute, I've used it personally and with patients with when they have an acute onset of an upper respiratory infection, it really shortens it, sometimes just obliterates it.
Because again, of the antimicrobial effect of it, coupled with the fact that silver is an oxygen sponge. So when you're nebulizing silver, this is a really fascinating point. You're getting 10 times more oxygen than you would otherwise be getting breathing the way we are. 10 times. Wow. That's orders of magnitude more oxygen you're getting with a nebulizer with silver than you would be getting without it.
Well, that's where I was going with this.
Oxygen therapy.
What are some aspects of it? So does it go systemic? Like, does it get into your bloodstream? It will go systemic.
Yes, it will.
Cross the blood-brain barrier.
Some of it will cross the blood-brain barrier. Again, subject to particle size. Particle size is everything.
So this is big. For those of you that are watching this, that is a big deal. That means that you can just use a simple nebulizer at home, and you can get a pretty profound potential systemic effect.
And it's preventative, because to your point of the biofilm, taking the biofilm out is a preventative.
You can use this. You can use silver prophylactically. Nothing's wrong with you. You just want to maintain a vibrant immune system. That's what it's going to guarantee you to do. A proper product is going to ensure that you have a very vibrant, powerful immune system. The weaker the silver, obviously, the less discernible any therapy. That's another rub. That's where you get to really find out. Use a silver that's bottled in plastic. Half of the effects you're going to get are going to be placebo. I'm taking this, and I know it's.
How about for oral conditions and skin?
Absolutely. I led the charge to get us into the biological dental market years ago, and we now have a huge footprint in that market. Biological dentistry.
Yeah.
So there's all sorts of good effects to be had from silver in the mouth as far as the oral microbiome. Yes, brushing your teeth with a non-fluoride toothpaste. Yes, flossing your teeth. Yes, the diet. Everything goes in your mouth.
But just the consequences, and I'm sure you could speak to this, of having bad gums and the inflammation in the gums and the bacterial.
There was a
growth,
study
And cavitations.
not even a year ago. Well, I mean, not even 2 years ago. CDC had it out. 7 out of 10 degenerative conditions are created from oral microbiome. Bad
completely
oral
agree.
microbiome.
7
out of 10 bacteria in your mouth.
I think it's even more than that. I think it's even more than
Well,
that.
I'm just quoting that study.
I will tell
7
you
out of
guys, and
10.
I know this because I spent a lot of years in the business, especially with dentists for the last 5-6 years. Your health, your overall health, all of our overall health starts in the mouth.
Yeah, that's where the estimate.
How does your mouth look?
80,
How's your mouth feel?
80% of disease, they say, starts in the mouth. But
Exactly.
that was degenerative.
Well, that I'm sure people are watching this and they're thinking, well, that seems kind of far fetched. Like, how do they make that connection? But when you understand that, it goes from the mouth into your gut, and it's constantly flowing into your gut.
Right.
So
That's the issue.
it just doesn't. It's a no-brainer to realize that if you're seeding your gut with negative bacteria, they have something called dysbiosis.
Yes.
Or you
yeah,
have
dysbiosis.
the good and the bad bacteria. So if this is constantly growing in your mouth, and then you're basically inoculating your gut with this. just
Well,
nasty
again, this
bacteria.
microbiome affects this microbiome. This one affects this one, and I don't want to
all
forget
connected.
this one,
Yes.
as
Yeah.
you're using all the Perels, affects this one and this one. I mean,
Yeah.
literally, these guys talk to these guys. We
Everything
should bring in
goes-
Dr. Alex because we
Yeah.
were just talking about application. Dr. John stepped out. He'll be back in a second, but you do a ton of application in this office.
Yeah.
So talk about it.
So I was going to ask you, we do a lot of applications with rectally with a lot of different medicine. Do you have any like, can you speak on that as far as using the silver rectally?
As far as using silver, you want to get it as close to whatever issue it is that you're working on
Yeah.
physically. So what's the physiological aspect for rectal? Let's see, liver, colon. You're going to want to go either of those 2 ways. And I believe that obviously oral for systemic, and then hit it direct, wherever that direct is. If it's something vaginal for a woman, you can do intravaginal insufflation, colorectal insufflation. Again, find those places in the body. The physiology is amazing. We have this huge body, right, that allows us all sorts of things. We've got orifices, 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 and orifices. And as close as you can get that coupled with the oral dosing for systemic, the thinking is you attack it from the inside out and the outside in.
Right.
It's
Cool.
it's a real double punch.
And it's nice because there's specificity to which the silver attacks as far as the bacteria, good versus bad. So using it in the
And it remains, Doc, an unknown mechanism. We still, and we've been at this business for 20 plus years, but and that's just us. There are centuries of research long before us. It remains an unknown mechanism, just why it's so selective, but it is selective. And the fact that it's selective is, again, the genesis of what makes it so special.
Right.
There is no ill effect to be had from it. It's like anything in excess. Yeah, you have too much silver, you can turn blue. You have too much sodium, you can die. You have too much water, you can drown. You know, it's these funny things, but they all have roles in our lives. Silver has every role in human physiology, like I described.
Yeah, it's awesome overall. So yeah, we use a lot of it.
I tell you what I love is there's a protocol. I forget what doctor maybe came up with it, but it was something you shared with us early on. And it involves sipping the silver, gargling with it, and then you're actually laying in different positions to kind of coat the stomach.
Right.
And then the eye drops. I mean, it's just so comprehensive. Maybe you
Yes.
could speak to that a bit.
Actually, you're describing, I believe, the H. pylori protocol. That's
Yeah.
not for the eyes, but that is, yes, that
That
involves
is
the
H.
multiple
pylori,
positions.
yeah.
The multiple positions. So you start with a seated dose like this, and you do the first dose with 2 tablespoons of the silver and 2 tablespoons of aloe gold. It's the best aloe juice on the market. Mixed, swallowed straight to an empty stomach, and it's followed immediately by another dose of just the silver. 2 tablespoons swallowed straight to the stomach, for the pan of the stomach, if you will, the bottom of the stomach. Then you stay that like that in that position for 10 minutes. You do your second dose, you lie on your right side for 10 minutes. You do another dose, you lie on your left side, fully left, horizontal, for 10 minutes. Then you lie supine for 10 minutes, and then you lie flat on your belly.
How
Another
about
2
on your
tablespoons.
head?
No, you don't do that. No. But that's why you do you're doing so many doses. You're getting the esophagus, you're getting it all the way down, and then you're getting every surface of the stomach.
Well, I'll link to that, and we'll have the protocol in the transcripts. But I think a lot of people watching this may not really appreciate what a big deal and how pervasive H. pylori infections are. I mean, isn't it the most common cause of heartburn?
Of heartburn, I believe it is, and it's so common in foods. So what's the contamination level of the food? Yeah. What are you getting for food? We always come back to food. It's ironic, but not. So we're always coming back to food. Where are you getting your food from? What kind of food are you getting? If you're eating junk, you should expect to feel like junk.
Maybe, I know a lot of people have pets out there, so maybe you could speak to using silver with your pet or animals or livestock.
We have a baby Great Dane at home.
Uh-huh.
He's 8 months, so he's not that. He's a baby who weighs 125 pounds. And he can't wait for us to get home. I load him up on silver all the time. All the time.
How do you dose him?
I spray him.
I just dump it in my dog's water. Is what I do.
You can do that too. If it's a metal or a glass bowl.
Yeah, it's a
Pyrex
ceramic bowl.
That's fine. Not in plastic.
Yeah.
Don't put silver in plastic, and I think that's another huge takeaway for your viewership. There is nothing good that will come from silver in a plastic bottle. The bad things that will come will be phthalates, all the petrochemicals, because plastic is a petroleum byproduct, and that's the big cheat.
So the silver's leaching these things?
Leaching the plastic, leaching the walls of the plastic bottles. Plastic is a long chain-like molecule, right? And it just leaches and extrudes it. So you end up with plastic in the solution. I always ask people who take any kind of silver product, colloidal silver in a plastic bottle, have you had your dose of plastic today? It sounds like a very innocuous, lovely question, except have you had your dose of plastic today?
Yeah.
It's a really awful thought. We've never made anything in plastic.
That's almost a whole different episode to get into and dive into all the toxins that we get. But we don't even realize we're getting these toxins.
Correct. They talk about BPA-free liners. What about the other BPs in the liner?
Yeah, no, it's
there are lots of
BPA-free. There's a zillion other chemicals in plastic.
Exactly.
Yeah. I think that there's some silver lining to this because a lot of people are really starting to wake up.
Yeah.
The only thing that you've got that you can do on your own is really to boost your immune system and things like ozone or silver that are completely natural.
And sunshine and positivity.
Vitamin D.
Swim.
Yeah.
Exercise. Get out there. Do something. Don't have this mentality, this siege mentality, which this country and all the others around the world are preaching. Right. This siege mentality. That breeds fear.
That circles back to the immune system. So all these things are boosting. It's the host. The health of the host. You want to get yourself healthier if you want to, no matter what it is. I mean, the healthier you are, the more likely you are to survive that.
Right. Absolutely right. So again, back to diet.
Yeah.
Diet, great water. Make sure you don't have fluoride in your toothpaste. Equally important or more, make sure you don't have fluoride in your water.
This is our rapid fire portion. And so I ask all my guests, give me your 5, in just like a 1 sentence, 2 sentence, your 5 top strategies to prevent a viral infection, and then your 5 top strategies if you have a viral infection, what you would do.
Okay. So to prevent, obviously, you want to limit your contact with those who are sick because things are transmittable a variety of different ways. Communicable diseases. The more vigilant your immune system is, the better off you're going to be. So again, we come back to my favorite, diet. Live organically. Live the way we used to live. I'm a big fan of paleo. I'm sure you guys are too. You, I know, especially. Paleo and intermittent fasting.
Yes.
But you both look it. So, and I got to get to there. I got to get to that place. But either way, a really good diet, lots of sunshine, lots of good spring water that has no fluoride. Wow. I'm not a huge fan of Whole Foods anymore. However, the 365 spring water is good water with no fluoride, and it tastes great. And I have a really great taste for water. I love Fiji because of the amount of silica in it. So sunshine, diet, lots of silver. You can take it. I'm a big guy. I do a tablespoon because I'm 6'3", 6'4". I weigh 220 pounds, whatever. I'm a tablespoon at a time. I hold it in my mouth for 1 to 5 minutes. The longer you hold the silver in the mouth, the deeper the absorption. You go 9-10 minutes, you're getting as deep as you possibly can. You get down to the spleen. With our silver. The same can't be said for another silver, even though I'm sure someone in your viewership will have access to someone at another silver company, and they'll take a snippet of this, and that person will run with it at that company saying, we've got all this, and they have nothing, diddly squat. That should be the name of their brand.
Excellent.
So I love our products. They are completely bioactive, completely bioavailable. I can spritz them in the eyes, my nose, my ears, topically. There's nothing you can't do with them. In the midst of something, if I'm just coming down with something, I will literally do a dose every 15 minutes. I'll do an oral. I'll hold it in my mouth, a tablespoon for me. My kids
Maybe
a teaspoon.
nebulize it.
You guys would be a teaspoon or two. Nebulize it.
Mm-hmm.
A teaspoon nebulized. Will take about 10 minutes in a nebulizer. When you're done, turn the machine off so you don't burn out the pump. Rinse it with tap water, dry it with a paper towel, put it away for its next use. It is a standard operating procedure, so you don't leave the silver sitting in the plastic receptacle
That's a good
of
point.
the nebulizer.
Good point, yeah.
You don't do that ever. You're going to sit down, take the 10, 15 minutes to yourself that you will need. Focus on yourself. Love yourself. Give yourself the nebulizer treatment. Clean the nebulizer, put it away, turn it off, put it away. You're done for the next time you need to use it. It's there for you, for Junior, for whoever needs it. Keep doing it. If it's in the eyes, I'll spray it in the eyes, our product. I'll use it in my ears, a whole dropper full. If it's a very embedded sinus infection, I will lie down flat on the back of my bed, this side of my bed, hang my head off the side, and a dropper full up each nostril, and hold. Sit up, blow your nose. If you have to do it immediately, because there'll be a burning sensation. That's the potassium burn. You should expect that. Anytime you've got an infection, it's usually cells full of potassium. Now you're looking at the sinuses. So highly sensitive, the sinuses, right? They get washed with potassium. You want to talk about a burn, it gives you a potassium burn. It will bring any grown man to tears. Blow your nose, you do it all over again, less burn. Why? Less infection.
Interesting.
You can do it as much as you want, as often as you want. I always tell people, the only way you can hurt yourself with anything we manufacture is if you drop a gallon on your toe or you drowned in it. If you didn't drop a big bottle on your toe, which would be a combination of the weight of that bottle and the fact that it's glass, look for glass. Make sure whatever silver you got is in glass. So Sovereign Silver Argentin 23 would be in glass. If you didn't drop a big bottle on your toe and you didn't drown in it, do not call me and tell me you hurt yourself.
Wow. Seth, I mean, you are a wealth of information.
Yeah,
I
man.
mean, this
So
has
happy to
just
share
been
that.
such a
Glad
great
you, and thanks for
interview.
having me here. Awesome, yeah.
Thank you for having me
All
here.
right, man.
Love you,
Absolutely,
brother.
yeah.
Love
Love
you
you too.
guys.
Yep.
All right.
Yeah.
You're awesome.
Yeah. You know, I'm so happy to have Dr. Dan Pompa here with me. He's, he's helping me with this interview. He's co-hosting. He happens to be in town. Just amazingly, they're filming a Cell TV, which, if you get a chance to log on and check out Cell TV, they've got some really great topics, in line with some of the health related things that we're talking about here with the summit. But I've got Dr. Pompa here with me. We're going to do a wrap up. Yesterday we interviewed Seth. It was amazing.
Yeah.
I mean, there was so much great information that I had no idea about with silver.
Even how it started, the blue bloods. I mean, I didn't know that was because of silver turning people blue, right? So I learned a lot like right out of the gate, and then it kept building. There was so much that I got super excited about even through the interview.
Yeah, and even with people eating and drinking from their silverware, because back with the bubonic plague, and the people that had the silverware were the rich people, they didn't get sick. But even with that, they might have turned blue, but they didn't get sick, right? So the safety with silver is just incredible.
Well, I think that it brings out, and I think one of the questions I had asked, or at least brought out and made clear, is even though they turned blue, there was no other health consequences. It was just being stored in the tissue, which, again, he went on to explain, obviously, that this silver doesn't turn you blue if you drank gallons of it, right? And there's a reason why. But to the point, the blue bloods may have been blue, and because they're pale complex, because they didn't work, and the silver was making them blue, they didn't get sick. It's remarkable. I think another thing that stood out, too, which I didn't know, is that how this was in everything natural. Silver is in everything natural. I mean, mother's breast milk, right? I mean, we're exposed to silver every day as this natural antibiotic, antiviral, antifungal property, that I had no idea. I really didn't understand. Oh, and then the receptors in our nerve tissue.
That's what I was going to say. Like, what's more important than your nervous system? It controls everything. And you have receptors for silver on the nerves.
Oh, man. Yeah, and then you asked, you were like, it was coming off of my tongue next. It's like, what about neurodegenerative conditions, diseases, right? And, because, we know these can be activated by pathogens, right? And so if you're filling those receptors with silver, something that has an anti-pathogen effect, and the pathogens drive an autoimmune effect, because some people watching this might say, yeah, this is autoimmune, those conditions are a lot of autoimmune connections. Okay, but what's driving the autoimmune? Could silver make an impact there? And I think some of the studies or some of the things you said is yes, they can.
Well, I always say, because we get a lot of patients coming to our clinic that have autoimmunity, and they're just stuck on that, autoimmune. And so my personal philosophies are that there's always some toxicity or infection that's underlying that. But the immune system is not just doing it, something that is just random. It's actually trying to do its job.
Yeah. One thing I want to even portray to people even watching this little segment here is you told just a kind of a piece of your story, but right before we even shot this, you looked at me, you had emotion, and passion behind it about this silver interview, because you said, Dan, really, when I was sick, I had been to Germany, I had been everywhere, I had Lyme disease, I was sick, I didn't know what. You literally picked up yourself, went to the factory where they make this stuff. That's something I would do. And when I was sick, I always say, I would go, if someone had something I didn't have or think I would help me, I was there, right?
Yeah.
And you went there and you said, I know you didn't say this in the interview. You said, look, I've been to Germany, I've been here. And he looked you square in the eyes and said, you're in the right place.
Yeah.
And then he literally provided you with the protocols that you do in your office every day, all right? And I know you're teaching, I'm teaching other doctors. Like if you're not doing something as simple as some of these protocols with your patients, why not?
Yeah. Well, what's nice about silver is you can continue to do everything else that you're doing. You just can add silver in there. Like it doesn't interfere with, it goes well with vitamin C, it goes well with ozone. Some of the things that we're going to be talking about in this summit, just about everything that we're going to be talking about, you can add silver to that protocol and it'll be better.
Absolutely, and it's so simple. I mean, even the stuff in the interview that we gave, you can do this. So much of it, obviously you can do at home. One of the things I have to bring light to the fact that why you even did this summit, why I appreciate it is, there's so many things that you and I just come out of our skin like, I can't believe doctors aren't doing this. I can't believe people don't know this, right? Yeah. Ozone. I know you interviewed Schallenberg, and it's just you put ozone, something so easy. There's expensive applications, but most of it's so inexpensive, right? With the silver and with a lot of these other simple strategies you're bringing out through these interviews, man, it's like, the passion around it. You see these people freaking out right now at a time, and they're looking for this miracle. They're looking for the vaccine. They're looking for something. It's like, we already have it. Honestly, we already have things that are proven. I think that's part of your goal with this whole summit.
Well, there's a lot of misinformation out there. And, even recently there was, Jim Baker. He came out and we talked about that a little bit with the interview.
Yeah, I call it the 800
I'm not sure
gorilla.
Seth even knew, right? But Seth's the main guy in silver. And he's busy selling silver in the middle of this epidemic. And he just... But Jim Baker, he basically was selling some silver. I guess it was one of his events, at church, and the governing agencies came in and arrested him, and it was a big deal. And they made it out as if silver was the bad guy, didn't they?
Right. I think people took it that way. It's just their job is to bring bring things back to earth. Can't be making claims.
Yeah, and the bias with the with the media when it comes to something natural is just, it's so raw. It's almost like there's an agenda. And it's hard to pick up, I think, for the lay people, but people like you and I that are in natural medicine, and we understand the power of some of these things, and we hear some of the statements made by the media, like that silver has no medical benefit, and it's just, that's completely false. In fact, there's been some studies with even HIV. And SARS that showed that the silver was effective at actually killing these viruses and bacteria.
Yeah, Seth in the interview pointed out the problem. Can't patent it. If you can't patent it, a drug company can't make the money, right? And that's really the issue. No matter how you slice it, they're not going to back anything that they can't put a patent on. The moment they can patent something, they got excited about fish oil when they realized they could do some patents with it and take a little bit of fish oil in. So until that happens with silver, you're not going to get someone very excited about it. You're definitely not going to hear it in big media. But anyway, that doesn't mean that silver doesn't work.
No. Well, if you haven't watched the whole interview, I would recommend definitely logging on and watching that interview. And I had said before in the interview that there's a silver lining to this whole pandemic. There's a lot of people that are starting to wake up to the importance of taking care of yourself and strengthening your immune system, and even turning to things that are more natural. And the bottom line is that We just haven't been able to come up with any effective drugs for viruses. There's just none out there. So, the silver lining here is that we're learning more about silver. So thanks for joining me, and we'll see you next time.